Even though she's a good student, Lucy Gonzalez says she couldn't seem to finish some homework assignments until well into the evening.
I sat there and I honestly tried, and I would sit there trying to stare at the paper, and I'd end up reading the same sentence over 5 times, and I had no idea that I did that.
It turns out Lucy was suffering from the lingering effects of concussions. Starting with a soccer injury, she had 6 concussions in just over 6 years, forcing her to give up the game she loved. And Lucy's not alone. Since 1997, the number of high school students treated for concussions has shot up more than 200%. And nowhere are the consequences felt more than at school.
How hard are you finding it to concentrate?
Which is why some experts are now going into schools to put teachers through an innovative program called Concussions in the classroom.
What we want to do is really go into these schools and educate the educators and let them know that, you know, this kid suffered an injury and then they're not functioning at their normal level.
Dr. Stephen Cuff of Nationwide Children's Hospital Sports Medicine helped develop the program. He says concussions can leave students sluggish, irritable, and distant, which is often dismissed as typical teenage behavior. But Cuff, who is also with Ohio State University, says it's much more serious. So he's teaming up with athletic trainers from Nationwide Children's Hospital to go into schools and teach teachers what to look for.
You can't treat every concussion the same. So while most kids will get better within a week or two, there are plenty of kids that struggle for weeks, months, you know, occasionally even years.
Once Lucy's teachers knew more about concussions, they could tell when she was struggling and found ways to help her cope. By doing so, they helped her replace a love of soccer with a passion for art, and not only kept a good student engaged, but helped her excel. At Nationwide Children's Hospital, this is Clark Powell reporting.
I was just thinking along those lines.